We have Dr. Sudhir Srivastava back with us to operate a 64-year female who has both eye cataract, planned for right eye cataract surgery. We are planning isopure EDOF for this particular patient of IOL power of 22.5 diopters. Over to Dr. Sudhir's OT, please.
Good afternoon, everyone. Am I audible?
Yes, very well.
Okay. Good afternoon, Arora sir, Dr. Malay Chaturvedi, this evening, viscoelastic. You all must have done your lunch.
Some has done, some are planning to do, some are planning to skip it.
It's a good time to sleep now. Side foot, side foot, side foot. डिपॉजिटर चाहिए मेन एंट्री नहीं मेरा एक्सेस दे दो So I am trying to create a excess of around 5.5 millimeter. It's always good idea to have a circular good size axis because it should cover the IOL all around 360 degrees. Now main entry. थोड़ा सा लूज करना ऊपर से थोड़ा सा लूज करें to change my position. यहाँ से लूज करिए हाँ
Beautiful rexus, very well centered.
Yes, ये नहीं चाहिए रिपोजिटर चाहिए रिपोजिटर to hook. So normally I don't place any forceps. I don't use any forceps to hold conjunctiva because we are not operating conjunctiva. So why to hurt the conjunctiva? Blade is
This is close 2D.
I extended my my main clear corneal incision to 2.2 to 2.3 just to give good space and to avoid any kind of surge. Light में देखिए मैम. Yes, very nice.
There's rather hydro delineation plus
Normally I do it's always it's surgeon choice. Normally I do hydro delineation first and then I make my hydro. I do hydro delineation. Hydro visco. थोड़ा सा प्रेशर आएगा ठीक है एंजाइटी द्वारा हाँ ठीक इनकी बात कर लूँगा वहाँ पर ओके so always good idea to make the nucleus naked. Now this is vertical chop and now the piece since piece is out
लंबा चलता है वैसे लेवल का आप है ना
चॉप इस पे है ठीक है
या हाँ निकले
it is always, uh, safe to hold the tip of the appendicular plate. At- If you're not getting the tip, it is not wise to, follow the cortical tip under the capsular axis. And so it is not coming. Now आइए.
So doing hydrodilation increases the time, surgical time, or doesn't matter?
Uh, so I did the hydrodelineation and dissection both, sir.
Yeah.
Obviously, if your dissection is good, then this appendicular plate comes easily. But sometimes,
It provides radiation safety.
yeah. So suppose this is the situation because I'm not able to catch hold the tip of the appendicular plate. So what I do, this is the simple blunt curved cannula. I just place it in the center and just simply press it without irrigating. So it basically brings the some area of the tip of the cortex appendicular plate to the area where you can easily hold. Now I can now dial it or chopper, whatever. I'm using this machine after a long time, but I just talked to Dr. Gaurav. He has given me very valid and good suggestion. If you have different kind of machines in your theater, because I have this machine, so it is always a good idea to try to operate all on all machines. Do not leave machine and do not stick with one machine only. Hilon.
Keep them running.
Okay, all right.
So
Oh.
I left some amount of the cortical matter. Now अब वो हम कर लेंगे उसको. नहीं वो हमें भी तो देखना होगा ना, हमें भी देखना होगा. हाँ. So here I am going to implant isopure lens. This is a kind of EDOF and intermediate vision. It's a monofocal lens without any rings and without any visible change on the optics, and it gives the intermediate vision also, like other company lenses are available.
Dr. Sudhir, what's the difference that you find between this and the other EDOF lenses that you may have used?
The
Like,
first-
how is this
the-
better or different?
Dr. Gaurav, first thing is that I think this is the first kind of hydrophobic lens which comes in a fluid, and the company says that it reduces the chances of glistening anymore.
Great.
So now, because the lens is inside the cartridge, what we have to do, we have to place the thing and press firmly. It gives a click sound, and now this lens cartridge is inside because it comes in a fluid. So it's always good idea. Slightly push the lens and BSS ही चाहिए. and wash it. Wash it thoroughly, because we don't want any kind of fluid going inside the aqueous, means inside the eye, because it can give rise to any maybe a unknown kind of reaction. So now put, oh, now lens system is ready. लाइट में देखिएगा मैम, लॉक रिमूव करना
So
होगा.
VR person can see the VR surgery.
Sorry, Dr. Arora sir.
No, we are getting both
He
the
don't
views.
kill
We are
him.
getting VR surgery on one screen
Acha.
and this
Wow,
one on another screen. So, that's
audio is only from our OT, so
Yes.
video is also from both OTs.
But
That's
it's
nice.
a- it's a bonus.
इसको डालो.
Yes.
वॉश करिए, थोड़ा सा इंसिजन बढ़ाने के लिए बोलो. साइड पुट.
So how good is the intermediate vision, Dr. Sudhir, with this lens?
Dr. Gaurav, I think we are using we all are using, you know, intermediate vision quite often, because we are sitting inside the room and we are doing computer work or mobile. Where even whenever we are free, we use mobiles and other activities. So I think for me, intermediate vision is important. This lens we can implant through the wound assisted technique, but I'm not used to it, so I increase the incision a little bit, and now you can see the haptics. It has 4 haptics. It looks like it's a plate haptic, but it has 4 haptics, 2 haptics, leading haptics, and it is slightly blue lens. And now all haptics are inside the bag. Wash. Now time for visco removal and लाइट में देखिएगा मैम, बहुत अच्छा. फोकस नहीं आ रहा है. Yes. लाइट में देखिएगा. So now safely with the IVL scaffold optics, you can remove the viscoelastics. We are older generation surgeons, so still we are using the coaxial, and newer surgeons are using bi-manual. It's a good idea to shift, but because I don't want to extend my side port incision, that is why I'm still comfortable with it. This is saline डालिए. I always go behind the IVL to remove the visco. Yes, done.
Excellent. Dr. Sudhir, once again, how much accommodation or near vision it provides?
What? Sir, I recently I implanted around maybe 20 or 30 IVLs, and because I started using it recently, and for 10 or 15 IVLs I can assure you that it gives around it quite similar to the previous because we have used a good number of Eyehans implants, so it is quite comparable, almost comparable, I can say, because if the patient is emmetropic, then we used to give 1.5 or 1.775 diopters of additions, which is, I think it's a fair enough, because it makes you younger, like 40 or 45 years, because we are using more of intermediate vision. So I think patients are more happy with the intermediate. Sure.
Right.
And for me, I use a lot of even all variety of IOLs, multifocal, monofocal, premium IOLs, torics, and but personally, if you ask me, I still prefer EDOF lenses because the light distribution is very important. Any lens which cuts the photons, photons or distribute the photons for distance, intermediate, and near, it means that lens is not good, because in younger age we all have enjoyed the natural multifocality which focuses 100% for distance, intermediate, and near. So without dividing the photons, if we are able to give fixation for distance, intermediate, and near, then that will be a future lens. For me, still I am more comfortable with this material, means the monofocal lens with intermediate vision, and works. I think it is the boon in our practice, because maximum satisfaction will get when we when we give a monofocal lens, because it doesn't give any kind of photopsias, and patient has this decent perfect distance vision and a good near intermediate vision, and a little amount of intermediate for the near you have to give additions.
So we avoid all the aberrations and got a good quality intermediate vision also.
Yes, sir. Obviously we are waiting for toric lenses, because one aberration we cannot deal right now, because they are only available in spherical corrections, and spherical torics are not available. Maybe we'll expect in future we'll get toric also. Thank you. Over to you, Dr. Malay. Thank you very much, sir.
Excellent.
Thanks everyone. I think it's a time for sleep,
Yeah.
and still, if you are there, you are watching my surgery.
Really,
And
we are got a good number and we are all watching.
thank you, sir.
Yeah.
Thank you.
I'm
So
Vinod
kind of.
Arora.